What I'm trying to do today is bring to you information you're not hearing on cable TV, on network TV, on satellite TV, or most other places. We're just giving you numbers the CDC's pushing out and Johns Hopkins pushing out. And they're putting it on their screens like it's a basketball game. I'm trying to tell you that a lot of these numbers are misleading. Not because I'm trying to downplay this virus, but I'm trying to get as much accurate information as I possibly can. And when I get information that seems so obviously rational and compelling, I'm going to share it with you. I'm not into the hype game. There's enough hype going on, and this is bad enough. So we don't need to do that. So where I left off with the Dr. Katz piece, immunity occurs when our immune system has developed antibodies against a germ, either naturally or as a result of a vaccine, and is fully prepared should exposure reoccur. The immune system response is so robust that the invading germ is eradicated before symptomatic disease can develop. Importantly, that robust immune response also prevents transmission. If a germ can't secure its hold on your body no longer serves as a vector to send it forward to the next potential host. This is true even if that next person is not yet immune. When enough of us represent such dead ends for viral transmission, spread through the population is blunted and eventually terminated. This is called herd immunity, H-E-R-D immunity. Now, what we know so far about the coronavirus makes it a unique case for the potential application of a herd immunity approach, a strategy viewed as a desirable side effect in the Netherlands and briefly considered in the UK. The data from South Korea, where tracking the coronavirus has been by far the best to date because of all the tests they did, indicate that as much as 99% of active cases in the general population are mild and do not require specific medical treatment. The small percentage of cases that do require such services are highly concentrated among those aged 60 and older, and further so the older people are. Other things being equal, those over the age of 70 appear 3 times the mortality risk as those aged 60 to 69. Those over the age 80 at nearly twice the mortality risk of those over the age 70 and 79, and so forth. These conclusions are corroborated by the data from Wuhan, China, which show a higher death rate, but an almost identical distribution. The higher death rate in China may be real, but is perhaps a result of less widespread testing. Less widespread testing. What did the first article I say? Meant that we need widespread testing, which we're getting now. And the death numbers are a significantly bigger percentage by many-fold because you're applying it against a very relatively small population of those who've been tested. South Korea promptly and uniquely started testing the apparently healthy population at large, finding the mild and asymptomatic cases of COVID-19 other countries are overlooking. The experience of the Diamond Princess cruise ship, remember that ship that was stuck off California, which houses a contained older population, proves the point. The death rate among the insular and uniformly exposed population, roughly 1%. We have to date fewer than 200 deaths from the virus. We have about 1,000 now. Small data set from which to draw big conclusions. Still, it is entirely aligned with the data from other countries. The deaths have been mainly clustered among the elderly, those with significant chronic illnesses, such as diabetes and heart disease, and those in both groups. This is not true of infectious scourges such as influenza. The flu hits the elderly and chronically ill hard also, but it also kills children. Trying to create herd immunity among those most likely to recover from infection while also isolating the young and the old is daunting, to say the least. How does one allow exposure and immunity to develop in parents without exposing their young children? The clustering of complications and death from COVID-19 among the elderly and chronically ill, but not children, there have been a few rare cases, suggests that we could achieve the crucial goals of social distancing, that is, saving lives and not overwhelming our medical system by preferentially protecting the medically frail and those over the age of 60, and in particular those over the age of 70 and 80 from exposure. What he's saying further on in this piece is, look, we now have enough data, decent data, to know who's subject to the worst aspects of this virus, potentially death. They should be treated one way, where most young people who are healthy, under 50, should be treated another way.